Hi, my name is Dr. David Tenner of the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. Today I'd like to present an interview with a patient that we've been working with for the past few weeks. The patient came to see us with a diagnosis of metabolic syndrome, which includes diabetes, high blood pressure, high cholesterol, and weight gain. After a few short weeks in working with us, the patient has experienced significant improvements in each of his conditions. The following interview is a detailed account of the patient's own experience with us at the clinic and the significant improvements that he has seen while under our care.
Good morning, this is Dr. Paul Goldberg with the Goldberg Clinic. I'm here today with Mr. Jeff Weaver, who's been our patient for about 30 days now. And Mr. Weaver came in to see us with a number of health problems. And Jeff, tell us what brought you to the Goldberg Clinic.
Well, I started having problems with neuropathy. I've been diabetic for 16 years.
16 years.
Had just recently been put on insulin about 9 months ago.
Okay.
Blood sugar
Were you on medication, other medications before?
Yeah, I was on quite a cocktail of about 8 different medications for diabetes, for blood sugar, for cholesterol, for blood pressure, and then different side effects of those.
So you're taking drugs for your symptoms and then drugs for the drugs?
Right.
Okay.
So I had, over the course of about the last 2 years, weaned myself off of those drugs, but let the blood sugar continue to get out of control, partially because I wanted to prove that it was the drugs that made me gain weight, because I lost 60 pounds when I went off the drugs.
You lost 60 pounds just by getting off the prescription medications?
Getting off the meds, yes.
Yeah.
And but the sugar spiraled out of control, and I wasn't watching what I was eating, so went back to an endocrinologist, and they put me on insulin, which I needed to get under control quickly. Got the blood sugars under control, but
With taking the drugs?
With taking insulin.
Yes.
But they immediately wanted to put me back on more drugs, and I just told them no. Wasn't going to happen.
Okay. And how were you feeling generally in terms of your energy, your alertness, and other general parameters of your health while you were at this point?
Yeah, it was pretty lethargic. The high blood sugars were wiping me out. I'd be tired at the end of the day, go home. By the time I drove home, have an hour commute, but by the time I got home, I'd just sit around, didn't feel like doing anything. But as the blood sugars got better, I started getting a little bit more active, but then kind of out of the blue, I started having problems with neuropathy in my feet and legs, and then eventually in my upper body, around my chest. Sharp pains, tingling, kind of just a tightness in the chest.
Some scary
sensation.
stuff.
And I went back to the doctor. Actually thought I had an asthma attack because I've had asthma in the past, but they said that didn't appear to be what it was, but ordered a chest x-ray, which I never really went back for because the asthma symptoms went away, but that tightness in the chest never did. So I went back and asked him about that, and he said, well, you know, with that, it's probably another symptom of neuropathy, and you probably just need to go to see.
Related to diabetes.
Right. 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 And so he suggested a couple of different drugs that I could take, and I'm like, well, I really don't want to take anything. Is there anything I can do natural? And he said, well, you can try stuff, but I don't know what's going to help. These things really work for the pain. And I was like, well, which one's better? And he said, well, it's not a matter of which one's better. They both work great for the pain. It's just which side effects can you stand the longest? And I'm like, forget it.
Yeah.
So I never went on any of them. And that's when I was referred to you.
Okay. And you came to see us. We did a case history and a physical examination. We ran some specific functional laboratory tests for you. Got you on a program starting about 30 days ago. Is that right?
Close. A little closer to 3 weeks.
Only about 3 weeks.
Yeah.
What kinds of improvements have you experienced since that time?
Well, I was on 50 units of insulin total, 20 Lantus and 30 spaced throughout the day of Humalog, just to cover normal eating. And I wasn't behaving, as you said in our first visit. You wanted to frame my food log as what nobody should ever eat.
Right.
But within the first 2 days, I was off all of the Humalog insulin, so I was down 30 units. Within a week, I backed off the 20 units of Lantus by half. And then over the course of the next 2 weeks, I've gotten completely off the insulin.
All right, so we put you on a dietary program along with some other hygienic advice specific for you. I didn't give you any drugs, just a very few supplements to help out a little bit, but mostly it was just dietary reform, just some mild exercise, some things that were just tailor-made for you. I didn't wave any magic wands or crystals or anything over you, did I?
No.
And you've been able to get off the insulin now entirely?
Yes.
Entirely. Any other medications that you're still on?
No.
No. So
Just the supplements.
let's see. At one time, you were taking how many drugs? When you were at 8, and you were
seven,
getting
7 pills and a shot, which was a hormone shot for diabetes, not insulin.
All right. So you're on 8 different drugs. You weren't getting better. In fact, you were getting worse. Now you're drug free. You're off of insulin. And how would you say your weight is down? Is it?
Yes.
Okay.
Lost
about 12 pounds.
12
I think.
pounds.
About 12 pounds. Blood pressure down.
blood pressure's down.
Blood pressure's down considerably.
Very high to borderline.
Yeah, just in 3 weeks we've got you already down to the borderline. It's exposed to extreme hypertension before. And how are you just feeling in general?
Much better. Most of the neuropathy's gone. I still have problems with my feet at night, but I'm able to function throughout the day, whereas before I came 4 or 5 months ago, I could barely make it through the day.
So instead of going downhill,
pain.
you've leveled off and you're getting significant improvements.
Right. Been able to get back on the exercise bike, been able to do some light walking.
Yeah. And a population, as we have in the United States, where we're approaching almost 25% of the population is either diabetic or pre-diabetic. This is, I think, an important lesson that we get people in early, do the right things, get them on a program tailored to them. It's often possible for them to get off these drugs and get off of insulin. And we didn't tell you to get off insulin, did we?
No.
No. We always, of course, leave it to the patient in conjunction with their physician. But the fact is that usually if we do the right things for the patient, we get them in the early stages, we can get them off, they are able to get off insulin. And of course, usually, of course, their medical physician is very happy about that also, as are we. Diabetes has so many serious complications associated with it, including blindness and all these neuropathies, gangrene, kidney disease, arthritis, diabetic neuropathy, blindness. So it's very important we get people in early, correct the blood sugar issues, and get the whole body healthy simply by just creating the right conditions of health. All right, well, Jeff, we're happy that you're doing so much better 3 weeks out, and we look forward to just continuing a whole lot more beyond that.
Absolutely.
Okay, thank you so much.
Thank you.